Reduce the volume of that thing. I'm about to make a video. In today's video, we're going to be discussing, having a conversation about polycystic ovarian syndrome, symptoms of polycystic ovarian syndrome, and what is causing it. Every day, women as teenagers, 20s, 30s, 40s, get diagnoses that they're dealing with polycystic ovarian syndrome. And some of them is like a shock to them, and some of them is not. And some of them is like the first time ever they are hearing that word. PCOS simply means polycystic ovarian syndrome, and it can equally be called Stine-Levendal syndrome after the two men that discovered it, or hyperandrogenic anovulation. This really reflects the main cocoa issue that is behind polycystic ovarian syndrome. PCOS is different for PCOS is different from ovarian cyst. They are not the same thing because polycystic ovarian syndrome affects and cause multiple cysts, more than one cyst. Like sometimes a woman can have like up to 10 cysts, 20 cysts on one of the ovaries or both of the ovaries. That's a lot. That's a lot. That is why it's referred to as polycystic ovarian syndrome. That word syndrome there's because it goes on to springs up other health issues for that woman. So it's not more like just a disease. Syndrome is a combination of disease, risk, and factors. That is what makes up a syndrome. So because polycystic ovarian syndrome can entangle your hormones, it can entangle your metabolism, it can entangle your mental health, it can entangle your fertility, it can entangle your overall well-being as a woman. So that is why that word syndrome is attached to it. So that explained now. What is causing this PCOS? Like, what is behind this? So many women have asked, what did I actually do to deserve this? I actually don't know about this except until I got married and I was trying to get pregnant. It wasn't working. We visited clinics and that was when diagnosis was made. I'm shocked. And the many men are like, this is the first time they're hearing about this. Like, really, PCOS, what does it mean? Okay. And at that point in time, because that woman is told, oh, you're going to struggle to get pregnant, some doctors even get so bold and so and bluntly tell some in their face that you cannot have kids. Even if you will have kids, that it must be through IVF or through IUI. That there's some kind of assisted reproduction that must happen for you to have kids. That devastates that woman. It makes the husband feel like, what have I gotten myself into? And all the support you're supposed to get from your partner, you'll be lacking because you'll be like, we're beating a dead end like that, okay? But that is a false narrative, it's a false theory. Actually, that is not true when it comes to polycystic ovarian syndrome. We even have so many superstars, like people you know, prominent people you know that are dealing with it, that have dealt with it, and they went on to have babies. So it baffles me when somebody gets a diagnosis and you're told in your face, in the midst of your battling the diagnosis, you're trying to understand, process the whole thing, that adding salt to the injury, telling you, oh, you can't be able to have kids, even though it might seem like that trying to let you know what is at stake for you so you can face it head on. That is not true. And that can actually devastate your power to regain back your power to regain back your health, your hormones from polycystic ovarian syndrome. So we have different causes of polycystic ovarian syndrome. And these causes is where the types are linked. If you've got diagnosis of polycystic ovarian syndrome, I'm sure the first place you rush to is Google, right? Comment Google. That's where you rush to. You rush to Google to find out what is this, what is going on, what are the symptoms, what can I do? I'm tired. Like all of it, okay? It starts from the causes. So we have insulin resistant type of PCOS. We have inflammatory type of PCOS, and we have pill-induced type of PCOS, and we have adrenal type of PCOS. All of these things says so much about the causes. The insulin resistant type of PCOS, I'm going to dwell so much on this, like, explain it more. Why? Because it happens to be one of the most common type of PCOS. Like, if about 10 women get diagnosis that they're dealing with PCOS, 8 out of that women will be dealing with insulin resistant type of PCOS. So it's very, very rampant. It simply means that the way the body is supposed to use insulin, your body is resisting that. And majorly, we know that insulin helps to power your glucose level, like help your cells open it up and allow glucose to enter into it. That is where you get your ATP supply. That is your main energy, okay? So if your body is resisting that actions, it just simply means you're going to be having more of insulin being produced. And not just that the energy level is what is being unlocked, other hormonal pathways are entangled in insulin. Even fat storage is entangled in insulin. So that is why, because of that elevated insulin level, the male hormone that you have in small amount as a woman, that is the androgen level, gets so high, it gets so elevated. And once it gets so elevated, the signal that your body starts to get is that this is a man, in quotes. We're not supposed to cause her to ovulate. That means it locks up the actions of luteinizing hormone. It stops the actions of follicle stimulating hormone. It stops the actions of progesterone, because you will not be able to ovulate for progesterone to rise. Do you see how the dots keep connecting? So that is why the action of insulin is not just limited to your sugar level. It goes beyond that. It goes beyond that. So the question you should be asking yourself is, what is causing this insulin resistance? Why am I resisting the actions of insulin? And the emphasis should be on, how do I minimize or lower my insulin levels to the barest minimum? Because what it simply means is that once you get that you flip that coin, the elevated androgen level will come down. Your body will begin to get the signal that this is a woman, she needs to ovulate. And the LH and the FSH will do what? Align. So it's that simple. Then we have the inflammatory type of PCOS. This is when there is low-grade inflammations going on. These low-grade inflammations, many a times, it could be caused by toxins, it could be caused by what you are taking as a woman, your general lifestyle. And insulin resistance and inflammations coexist. Yes, you can't be dealing with insulin resistance without inflammation. So it's possible for you as a woman to be dealing with more than one type of PCOS. You see how crazy it can be. So you could be dealing with insulin resistance, there's inflammations, okay, going on. So that's it for that one. Then we have pill-induced type of PCOS. In pill-induced, it simply means that a pill was behind the hormonal disruption, which led to cyst formation. That is why you are advised to stay away from any kind of pill that will mess with your hormones, whether it's Postno 2, Postno 1, Postno whatever. Any kind of pill that you are going to take, and the action is going to be able to block you from ovulating or suppress a supposed you seeing your period, that is going to lead to cyst formation. From cyst formation, one cyst can appear, 2 cysts, 3 cysts, like that. It becomes polycystic. Many times, you don't even need to take that your drug for years for this to happen. So many women said it was just one-time exposure, and that's it. And that's it. Their hormones never recovered from it. The polycystic ovaries was really disturbing them, and they're like, what did I get myself into? So many times, the pill-induced is more common in teenagers, in women in their 20s, because that is when they do all these escapades unknowingly, out of ignorance, and later it will come telling on their hormones later. Next is adrenal type of PCOS, okay? In adrenal type of PCOS, it just simply means that the adrenal glands are under serious stress. And this serious stress, like, is chronic. When something becomes chronic, it's something that you have been dealing with over and over. Months, years, okay? That is why you don't allow yourself to get stressed out to the extent that the cortisol keep piling. What it causes is that it causes adrenal fatigue, it disrupts the hormonal pathways, that ability to ovulate will be stopped, honestly. And before you know it, multiple cysts will start appearing. I'm trying to break this thing down as, like, in a layman's language as possible, so that however, wherever you are in your state of education, you can be able to understand the information I'm trying to pass along, okay? So that's it for the types of PCOS. Then how come the symptoms? Because many women have these symptoms and they're like, I can't believe or I don't want to believe that it's PCOS that is causing this, because the symptoms, number one, they are overwhelming. They are overwhelming depending on the type of PCOS you are dealing with, depending on your lifestyle too. Very, very important, okay? Because if you're dealing with insulin resistant type of PCOS and there is pill induced involvement, there is inflammation involvement, the symptoms are going to be massive. And bear in mind that before we can actually record that, oh, somebody has been insulin resistant, it's not something you started dealing with in a month time. This is something that has been happening for 15 years. That's when someone can actually be saying, oh, I am insulin resistant. That means that pile up has been happening for a period of 15 years plus. That's a long time. So when the symptoms will start surging like this, it could be very traumatizing. We have psychological symptoms involved, metabolic symptoms involved, fertility symptoms involved, and others, okay? Number one, the psychological symptoms, when a woman is experiencing it, like the anxiety, the depression, the fear, yes. The last thing on your mind will be that it's PCOS that is behind this. But it's PCOS, how? PCOS deprives you of all your essential nutrients, especially many times you get that diagnosis and your next prescription is to be placed on some kind of metformin, etc. Those drugs deplete all the essential vitamins and nutrients in your body. These essential vitamins like the vitamin B12, B6, B9, 3, B1, your neurons, your psychology, your mental health needs it to function. Okay, yes. You see this happiness, this sadness, ability to sleep, feel cool. There are vitamins that are responsible for it. Once they drop, once they lower, don't be surprised that anxiety can step in, dementia, depression, suicidal thoughts, etc. It can get to that extent. Because many a times you experience that and your next line of action will be like, I'm under attack. There's a spiritual attack going on. I am not saying there are spiritual attacks, that spiritual attacks don't exist, but I'm trying to put it in the proper perspective for you so that when you begin to handle this, you start from the root cause. So that's settled. Secondly is the metabolic symptoms that comes with it. Once we're just talking about your metabolism, just know we're talking about everything that your body runs on to make sure that you are alive, to make sure that you're able to stay and watch this my video. All right. All of the processes that it has to go through, breaking down your foods, assimilation, removal of toxins, generation of energy, cellular maintenance, cell cleanup, cell death, like lots and lots of it. Okay. So number one is your lipid profile will get elevated. That is, you will start to have abnormal values of fats, high levels of fats. This is where you will do your lipid profile. You will notice that the total cholesterol is high, triglyceride is high, low density lipoprotein is high. High density lipoprotein will be low. What is it telling you? That the insulin, since it's not working, your body is in a storage mode, storing fats. And this time around, it has nothing to do with your consuming fatty foods. The carbohydrates, they have already gotten so stored that they just have to start converting it to fats. And it doesn't just happen in the blood vessel. This main thing happens in the liver. That is the scary part of it. It happens in the liver. That is why there is surge, increase in non-alcoholic fatty liver development and its involvement in polycystic ovarian syndrome. All right. Once you understand this whole thing I'm saying, for you to actually work on yourself holistically will be easy for you, because here I stand for alternative and lifestyle medicine, looking at our health holistically, okay? Walking the talk, okay? So once liver is involved, there's fatty liver accumulation. It simply means that the liver is piling up more fat quickly than it should really be burning them, all right? That's why you keep gaining that weight around your abdomen. The abdominal weight will come in. And if the liver gets so overwhelmed, they will start storing it in your intestine, go. Okay? Before you know it, the heart will get involved. That's why there's sleep apnea. Yes, that's moment of unconsciousness. Even though you are sleeping. It's as if you lost consciousness. Your breathing was paused for a moment. There's obstruction in your airway, okay? Because the airways are so rigid, highly cholesterized, okay? Piled with cholesterol crystals that will constrict it. Why am I explaining all of these things? Many people form to be ignorant in certain things, and when they are making the holistic changes, they don't get serious with it. They think it's just a joke over without understanding that there are deep things happening inside. This is not to put fear in you, but it's for you to sit up if you really want to reclaim your health from polycystic ovarian syndrome. So there's that massive weight gain. That massive weight gain. You all of a sudden, you just move from 60 to 100, from 100 to 200 kg, and you're like, what is happening? What is happening? There's no way ovulation will happen at that kind of geometric increase. So sometimes there could be acne due to the high androgen level, all right? There could be hair loss. Your hairs will start falling off because the high androgen level is there, okay? And the vitamins, the biotin, they are low, okay? Then sometimes sleepless nights are there. Type 2 diabetes can set in. Infertility, struggling to get pregnant. And if it's just about you struggling to ovulate, a woman will struggle to ovulate in polycystic ovarian syndrome. And after she ovulated, that egg gets fertilized. The womb receiving it again because this whole inflammation can alter the state of your womb. Okay, that's why it's as if there's recurrent miscarriage in polycystic ovarian syndrome. Many people, it's not about getting pregnant when it comes to PCOS. From what I explained in different types of PCOS, okay, some women have chronic anovulation, like they don't ovulate at all. Some women have this type of PCOS that they can ovulate, okay, just with small changes like this, they will ovulate. Why some? They will need to make massive, like long time changes before they can ovulate. Okay, so this chronic anovulation could be there. Then we have mildly anovulation. You could be dealing with chronic anovulation, but it's mild. You could be dealing with chronic anovulation, but it's severe. Okay, so it depends. And this is why so many women, you have your period ceased. You are not seeing your period. You keep taking concussions to push it out. Many times it will not come out because you're not handling it from the root cause. Okay, these symptoms that comes with PCOS, it varies from one woman to the other. You must not experience all of these things to know that you're experiencing polycystic ovarian syndrome. So according to Rotterdam criteria for diagnosing polycystic ovarian syndrome, the three major things, symptoms that should be present before we can say, oh, this woman has PCOS is irregular periods. Yes, high androgen levels. This high androgen level, it can be seen, we can be looked at and see that, oh, I have high androgen level. Facial hair. Okay, we're not talking about body hair. Especially this facial hair, the ones that extend to your chest, okay, like that. Then thirdly, the high androgen level, the one we can see, and the one that lab test reveals. Like you have gone to do your lab test and it says, oh, there's a elevated levels of testosterone, androgen level in your bloodstream, okay? Then finally is polycystic ovaries, which can be reviewed through ultrasound. So that simply means that the Rotterdam criteria says that that woman just needs to be dealing with two of out of these three I just mentioned. Must that you will have cyst on your ovaries to know that you're dealing with polycystic ovarian syndrome. You can just have elevated levels of androgen level, and you can just have irregular periods, and that's it. Okay? Or you can just have polycystic ovarian syndrome, irregular periods. That's it. Or you can just have polycystic ovaries and elevated levels of androgen level, and that's it. Okay. So, because many times women will say, oh, I have normal ovary. I went for a scan, they say there's no cyst, and really I'm having all of these symptoms. That means it's not polycystic ovarian syndrome. No, that's not the criteria for diagnosing it. Okay. So the facial hair, many times you're dealing with that facial hair and you're thinking that going to shape it out, lessen it out will be the solution. It's not the solution. The facial hair is simply appearing because of the high androgen level, which when you start to work on your insulin level, start to work on the inflammations, you will see that it will start to drop. it will start to drop, okay? So another symptom that I really want to stress on is type 2 diabetics. Dealing with polycystic ovarian syndrome predisposes a woman to type 2 diabetics and high blood pressure. And once that type 2 diabetes sets in, it's going to be like double work to work on the ovulation. Because the last thing on your body's mind at that time will be to conceive. It will be to let us bring down this elevated sugar level. And you don't necessarily have to be diabetic. It could just be that the numbers are exceeding the normal range by one, 2, 3, 4, 5, like that. Okay? It has already started entering into type 2, which is pre-diabetes to full-blown diabetes. And studies have told us that the same damage, the same internal organ damage that happens in full-blown diabetes is the same thing that happens in pre-diabetics. Okay? It simply means the insulin has gotten overboard. We have type 2 diabetes and type 1 diabetes. If insulin resistance is involved, that is type 2 diabetes. In a situation whereby your body is not producing insulin, that's type 1 diabetes, but it is not linked to polycystic ovarian syndrome. All right. Then we have constant bloating. Every time you're bloated, what is going on? Because you're not ovulating, progesterone will be low and your body tends to retain more water around your stomach area. So that's why the bloating is happening. Next is there could be pelvic pain, this huge pelvic pain, okay? Just because the ovarian volume, in terms of the amount of cysts on the ovaries, is becoming unbearable. Don't forget that the fallopian tube is a tiny tube that is carrying this ovary. So once the cyst becomes too much for it, you'll be feeling the pain. Okay. Next is recurrent infection. Especially candida infection. You have done insertion, done garlic. In fact, drank all the garlic in this world. Still, nothing is happening. No. The insulin resistance, the inflammations, the type 2 diabetes creates an enabling environment for recurrent infection to happen. So treating all the time with antibiotics, ketoconazole, is not the solution. The solution is to handle it from the root cause. Because when all these things are happening, your immune system will equally get weakened. And many times, the last thing on anybody's mind treating infection is to boost your immune system. The immune system will be down. How do you assess your immune system? Simply by doing full blood count. Just go and do full blood count. The total WBC, the total white cell count there is telling you how or the state of your immune system. All right. So next is that recurrent miscarriage I mentioned earlier. It could be traumatizing. It could really be discouraging, disheartening, because so many times you have worked on yourself to an extent and now you miscarry. You're like, what in the world is going on? Okay. The weight gain is on another level. And sometimes you don't necessarily need to have massive weight gain. Your weight can be normal. In fact, you can be lean. That's why there's even lean type of PCOS. You can be lean and still have polycystic ovarian syndrome. Then there could be high prolactin. Your breast could be discharging, but it doesn't happen for like 80% of women, okay? But it doesn't necessarily mean that PCOS is behind it. Many times it's as a result of the huge hormonal disruption that is going on. The prolactin will just start to misbehave. As soon as you work on yourself, it will start to correct itself back. Next is skin tags and dark skin patches or discoloration. Like you always have this discoloration either on your face or all over your body, or you have skin tags that can grow on the chin, on the back, even sometimes on your private part, on your labs, and you're wondering what is going on. Those skin tags can fall off if you reverse the insulin resistance. The dark skin patches, known as acanthosis nigricans, it's just simply because of the high insulin levels. That way, the skin don't glow. No matter what you use, your skin is still dull. You are even tired of using all these other products, okay? Then next is fatigue. This constant fatigue. You're always tired. Always tired. You get up in the morning, there's no energy to do your day-to-day activity. All right? And you're wondering what's going on. Next is could be blurry vision. You're struggling to see. It's as if your eyes are smoky, the environment is smoky. It's just because of the type 2 diabetics that could be setting in and gradually be impacting the nerves on the eyes. Sometimes high blood pressure is involved too. All right. So all of these symptoms I just mentioned, you don't have to be necessary. In fact, I don't even pray for you to be dealing with them at all. This video is just for educational purposes only, just so that you be in the know, just so that you get well informed. I've explained it like in a layman's language, so that next time you hear anything about PCOS, the causes, the symptoms, you are not confused, you are not thrown off balance. Okay, you know, PCOS and ovarian cyst, they are not the same thing. They are totally different conditions, and their approaches differ totally. All right. So if you really want to heal holistically, go through alternative and lifestyle medicine, drop a comment in the comment section and we will see what we can do about it, because you need to heal. And no, like you're tired, like that's if you're tired of popping in all the pills, you're tired of using artificial hormones to cause the changes. Okay, you want to give your body the chance to reverse the insulin, clean up the liver, clean up the hormonal pathways, and you will be good to go. He wish above all things that you and I prosper and be in good health. I don't think that the intention of God is to create us and make us go through all of these things, okay? Sometimes the enemy throws all of these things on you and you're like, God, why God, okay? But you have the power. You stand the chance to cause these changes. We just need consistency, persistency, and the I can attitude, I can mindset, and these things will crumble. So with this, I'll be saying have a wonderful day. If you're diagnosed with PCOS, let us know in the comment section, not to judge you or anything, but to lend a helping hand. I'm here to help. Bye-bye.